But the fact is you want to know that the medial collateral ligament is in contact with the medial meniscus, whereas on the lateral side that's not the case. Okay. And then the other thing as far as the mechanics of the knee, and this will come into play when we talk more in OD2 about orthopedic tests for the knee, is that when you externally rotate the tibia, it's going to put a little bit more strain on the medial meniscus. And then when you internally rotate the tibia in relation to the femur, it's going to put a little bit more strain on the lateral meniscus. So when we do things for testing the medial meniscus, you're going to do it in external rotation of the tibia. And when you're checking the lateral meniscus, you're going to do it with internal rotation of the tibia. And then, I don't think this is in the notes, but when you talk about mechanism of injury, is what's the thing that's going to injure the meniscus? Has anybody had a torn meniscus? What's going to cause injury to the meniscus is when you have compression and then, rotation. Okay? So that's the kind of thing where somebody's going to injure their knee when they said, okay, I planted my foot like this, and then I turned and went like that. Okay? Maybe they were wearing cleats or something. Their foot stayed planted, their upper body turned, so they had pressure or compression on the knee, and then rotation. Okay? So the big thing that's going to go on when you have knee meniscus injury is compression with rotation. Okay? All right, so as far as range of motion in the knee, like I mentioned, it's going to be pretty much just flexion extension. Okay? And then there is going to be a little bit of rotation when you're in a flex position like this. Like if you're sitting like that, your knee's bent like this, right? So if I can rotate my tibia, so if you feel on the front of the tibia here, you'll feel the tibia rotates, and you can feel the femur. The femur's not doing anything. Okay? The femur's just sitting right there. Okay? And when I feel here on the tibia, I can feel the tibia external rotate, internal rotate. If you feel on the fibula too, you can feel it move forward when you internally rotate, back like that. Okay? So that's where you have that rotation that occurs at the tibia. And then we'll talk about what's close pack and loose pack position. What would you say is going to be a close pack position for the knee? Full extension, like this. Okay, when you're extended like that, the joint surfaces are at maximum congruency, the ligaments are tight, okay? And then loose pack, again, loose pack is anything other than close pack, but usually there's a particular position that's the most loose pack, which is usually about 25 degrees flexion like that. Okay, so 45 would be all the way to here. 45 is about like so. Okay. So when you're doing ligament tests, you don't want to do the ligament, I mean you can, but if you're going to do ligament tests, you also want to do them in a little bit of flexion like that. Okay? So we'll talk, when you do ligament tests, well, I'll wait until we do the collateral ligaments before we do that. So basically when the knee's in this position like that, there's going to be more mobility in it versus if it's fully extended and locked like that. Okay? So what position do you think the knee is going to be more vulnerable to getting the ligaments torn? If you get hit from the side like that, if your knee's in a full extension like this, where it's close back position, versus if it's flexed like this? Yeah, like this. Okay, so if your knee's locked like this and you get impact from the side, there's no give to it. Okay, it's just going to blow the ligament. But if you're in this position like that, then you've got some way to absorb the impact. Okay? So that's why usually, like if you're playing tennis or something, or you're doing martial arts or boxing or whatever, you tend to be in like a position like this. Okay? So you can be ready to absorb some force. But if you're just like this, you're just like you're sitting duck, just bam. All right. So now we'll start talking about the ligaments. Okay, so we're still talking about inert tissue, right? First we started with bones, and then we added the meniscus. So now we're talking about ligaments, okay? Ligaments are going to connect bone to bone, right? So if we talk about the cruciates, the best way to understand the cruciates and talk about what movements they allow and prevent is that the name of the ligament is going to correlate with what it does with the tibia, okay? So when you think of the ligament, think of what it's doing with the tibia, all right? So if we're talking about the anterior cruciate, that's the one that's going to be more to the front, and it attaches anteriorly on the tibia, but it attaches posteriorly on the femur. So that's why I say if you think of it in terms of the tibia, the name of the ligament will match up with the tibia better than it does with the femur. Right? So the anterior cruciate is going to attach to the anterior part of the tibia. And what motion do you think it's going to prevent? Which movement of the tibia in relation to the femur is it going to limit? Anterior. Right? So just think of the name of the ligament goes with the tibia. Right? So the anterior cruciate is going to prevent anterior motion of the tibia in relation to the femur. So then, let's take a guess. What's the posterior cruciate going to do? What part of the tibia is it going to attach to? Posterior. What kind of movement of the tibia in relation to the femur is it going to limit? Posterior. Like that. Okay? So that's basically the best way to think of it in terms of the name of the ligament goes with what happens at the tibia and not so much with what happens at the femur. So then the medial collateral ligament is going to be from the adductor tubercle on the femur, and then it's going to go medially to the tibia on the other side of the joint. Under tibia. Okay? And then what kind of motion is it going to stabilize at the knee? Which going? What's going medial?
Knee going medial.
Yeah. So what would we call it in terms of when we talk about valgus and varus, right? What does valgus mean again?
In.
Yeah. But if you want to use something to think of valgus and varus that applies to any joint, no matter what it is, because if you're talking about the elbow, you're not going to say, well, you're knock knee, right? You say, you look at the distal part of the joint moves away from the midline, or it moves laterally, means valgus. If the distal part of the joint moves towards the midline, that's varus. Okay? So if you're talking about in the knee, then genu is the word for knee, so genu valgus would be knock knee, and genu varus would be bow leg. Okay? And then if you talk about the elbow, the distal part of the extremity moves away from the midline, that's valgus, this is varus. Okay? So that applies to whatever joint you're talking about, because when we get into the foot, you'll talk what's called hallux valgus. Okay, that's another name for bunion. So that's if this was the foot, the big toe is moving away from the midline would be valgus, and then towards the midline would be varus. So if you just think in terms of that, whenever you're talking about valgus and varus, the distal part of the extremity that moves away from the midline or laterally is going to be valgus, and then towards the midline is varus. So now, which movement is the medial collateral going to limit? Valgus. All right, so if we're talking about mechanism of injury for the medial collateral ligament, what kind of, if somebody is going to have a blow to the knee, which side are they going to get hit on to injure the medial collateral ligament? It's going to come from this side, or it's going to come from this side? Lateral. So it's going to go like that. Okay? Unless you're talking about getting hit in the lower part of the leg. So if the leg's not fixed, and then it gets pushed out that way, it's going to injure the medial collateral. So then conversely, if you have a blow to the medial side of the knee, if it's stabilized, the lateral collateral is going to be injured from a medial blow. And then medial collateral is going to get injured from this side.